You're watching We've Got Your Back on ABC 27, brought to you by Penn State Milton S. Hershey Medical Center.
Welcome back. A Dauphin County woman never thought her lower back pain would ever go away. It was debilitating. 68-year-old Patricia Day loves to bake. On this day, she's whipping up a lemon blueberry scone, something she couldn't do 6 months ago because of chronic lower back pain.
It wasn't like ordinary pain. It was horrible. It was excruciating. It really was.
The pain forced Patricia's lifestyle to change dramatically.
I had lost my whole life. I wouldn't do things. I couldn't go do social activities. I'm a big reader. I love to read. And I couldn't read because I couldn't concentrate. I would just sit here and stare at the TV.
Patricia gave physical therapy a try.
I went twice, or 3 times, I guess. The first time they came here, and then after that, I got well enough I could go there. And it didn't really help.
Then she met Dr. David Pt.2 at Penn State Hershey Medical Center. He suspected the pain was coming from her facet joints.
You can see this little line here is the facet joint, and there's clearly some arthritis there in the facet joint, and certainly that could cause back pain as well. One of the diagnostic tests we use to decide if it's disc pain or facet joint pain is the diagnostic medial branch block, which is blocking the nerve that goes to the facet joint. So if you block several of these nerves to temporarily denervate the facet joint and the pain goes away, then we think that means the pain is coming from the facet joint and not the disc.
The test only lasts for a couple hours, but for 2 hours I was pain-free. It was amazing, absolutely amazing.
So of course we went on to the next step, which is to offer the radiofrequency treatment. The radiofrequency treatment is a technology using radiofrequency energy, which is alternating electrical current to cause heat to generate at the tip of a needle. And using this heat, we literally cook the tissues, which include the medial branch nerve. And if we heat the tissues appropriately and heat the nerve appropriately to cause it to break down, this can provide up to 12 months of pain relief for the back pain.
It is instantaneous. It's like it just quits hurting. It just quits hurting.
Now Patricia is pain-free, and what a difference that makes.
I can walk on my treadmill, I can walk outside, I can go do things. I can cook. Our gorgeous scones. I can engage in the activities of daily living. It's changed my life totally. Not just a little, but totally. Like I have my life back, which is wonderful.
It is amazing how this radio frequency treatment works. Dr. Pt.2 says the treatment usually lasts from 8 to 12 months, and then it can be done again. Chuck?
Deborah, it's amazing when we see the turnaround in these people. I love to see that story. Dr. Knob, we talked about needing surgery, not needing surgery. Patricia is one who did not need surgery. How common is that?
Actually, a majority of people that have back problems don't need surgery. Probably 95, maybe even 98% of people who have back problems can be treated with conservative measures.
Well, let's talk about that. What are some of the non-surgical treatments? What can you do there?
They range from simple things like physical therapy. Obviously, there's lots of different medications out there that we can give to patients. There are other interventional procedures like epidural steroid injections, facet injections like that last piece just showed, radiofrequency ablation. We also have physiatrists at the Spine Center that can work with people to try to recondition their spine to help improve their symptoms.
Is this better than going through the surgery? I mean, is this you shoot for that first? What are the benefits of going that route?
Probably the biggest benefit is you avoid all the risks that are associated with an operation. I tell my patients all the time, if I can make you better with an operation, that's better for you in the long run.
All right, just generally, somebody's watching this, feels that they have 100% back. What are the things you can do to prevent spine problems?
Unfortunately, we don't know for sure, but we think that maintaining a healthy weight, limiting tobacco products or nicotine-containing products, maintaining a healthy core muscle strength. Things like yoga, Pilates can help with that, and generally staying active. So active people tend to have less back problems than people who are sedentary.
You mentioned the weight. Does that? I'm picturing, all right, if you have a belly there, does that pull in the back, or is that too simple?
No, it's very simple. It's a mechanical problem. Your spine has to support your body weight. If there's more of it, your spine has to work harder.
Very simple. So eat healthy too.
Exactly.
Thank you for joining us tonight, Doctor. And Deborah, we're going to check back with you again, and the phones have not eased up since I talked to you the last time.
They have not, Chuck. In fact, we do have some more viewer questions right now. Since having a fusion in my back 12 years ago, I've had chronic pain in my lower back. I cannot take pain pills due to having gastroparesis. I had to quit driving, going to the movies, and sitting for long periods of time. Would physical therapy help? What else would you suggest?
Well, certainly physical therapy can be an essential component of managing chronic lower back pain. They offer a number of different approaches, whether land-based or water-based, that are aimed to restore your function and hopefully lessen your pain. And like Dr. Knob and Reiter have already alluded to, probably one of the most important parts is to have a healthy lifestyle. They should help you to develop a home exercise program, which you can use on a regular basis. You should eat right, maintain an ideal body weight, and strengthen your core, and all these things will be essential in keeping you healthy in the long run, as well as minimizing your back pain.
Okay, we also have this. A few callers in the last couple of minutes would like to know, is the treatment Patricia Day had an option for everyone with lower back pain?
Well, in actuality, it's an option for the minority of chronic low back pain sufferers. If you look at the causes of low back pain, we believe that the most common cause is degeneration of the intervertebral disc. After that, you have a number of causes, including the facet joint, which was causing Patricia's pain, the sacroiliac joint that we discussed earlier, myofascial pain, and a number of other potential causes.
Okay, thank you so much, Doctor. Once again, if the phone lines are busy, because they certainly are, you can email your questions during the show to questions27@abc27.com. We will be right back with more of your questions. Stay tuned.